Good morning. Today I am going to discuss the MRI scans of a patient whom I am going to operate. The patient is a 69-year-old lady. She has been complaining of pain in both the knees. X-rays show that she has got grade 3 osteoarthritis or joint space narrowing. I have discussed the X-rays in a previous video. You can refer it up over here. I am going to perform PRS procedures for this patient, and before performing a PRS procedure, I like to get 3 Tesla MRI scans. Most patients are not aware of this and they go and get a normal MRI elsewhere like 0.75 Tesla or 1.5 Tesla. The advantage of a 3 Tesla MRI is that you can do a cartogram with this. Cartogram is an imaging modality on MRI where you can see the thickness of the articular cartilage lining the lower end of the femur, the upper end of the tibia and under the patella. In addition to seeing the cartilage thickness, you can also see the edema or the swelling within the bone, that is intraosseous edema. So I like to obtain baseline MRIs before the procedure, that is before the MRI, the PRS procedure is done, and then when the patient comes back, I ask the patient to come back after 6 months, I do a follow-up MRI. There is one video in which I have done the follow-up MRI for a 70-year-old gentleman at that time. You can see the evidence up here. That MRI shows that there was a articular cartilage degeneration which had regrown after the earlier I was doing bone marrow injection, so there was regrowth in the articular cartilage and also lessening of the bone marrow edema. So MRI 3 Tesla, that's the importance of doing 3 Tesla MRI. And not many centers are doing 3 Tesla MRI in Chennai. When you come to me, I will refer you to a scan facility center, and there the 3 Tesla MRI can be done. It doesn't take much time. It takes about 20 minutes for each knee. And of course, if you are accustomed, if you don't have any phobias of closed spaces, you'll be able to easily tolerate. They will provide you music in the MRI scan room and it will go on smoothly. But if you are afraid of getting an MRI done, they will then probably sedate you and get the procedure done. The reporting is done. The reporting is very, very accurate. In this, I will show you the types of film MRI modalities they have done on this. We want T1 images, T2 images, proton density images. Proton density images are what determine the best modality to see the thickness of the articular cartilage. And then T2 is to see intraosseous edema. So this is the MRI of the right knee of this patient. I'm going to modify the light here so that you will be able to see the effect of see the changes in the MRI scans. Okay, these are sagittal images of the knee, starting from the top and going up to the bottom. Starting from the inner side and going to the outer side here. You can tell that it is the outer side of the knee because the outline of the thin bone, that is the fibula bone, is seen here. So this is the innermost side, innermost section, and this is the outermost. These are the outermost section, and here it goes into fat. So we are now discussing the right knee. I have discussed about this right knee in earlier video. I've shown you the X-ray films, and I promise that I will be discussing the MRI films. So this is the inner side of the knee, and you can come to see the cuts over here. This black portion is the outline of the lower end of the thigh bone. So on the inner side, you won't see much bony edema. You might probably, there's not much bony edema, but the cartilage is narrowed. This gray area is the cartilage, and here it is narrowed. Again, here it is narrowed. But when you go to the outer side of the knee here, you start seeing bony edema. You can see these areas of white as compared to this. There's nothing much. If you just close in on this, you can see some areas of white here. And the cartilage is decreased, cartilage space. There is more water here in this particular section. You can see more water here. The cartilage is gone under the lower end of the femur. These two sections are more revealing. See, outer end of the outer end of the thigh bone, that is the femur and the tibia, there is grade 3 cartilage loss. These are the sections of the patella or the kneecap, and then again on these X-rays also this is the skyline. These are called skyline views, and on these you can see that this is the outline of the patella. This is a normal cartilage. Here the cartilage is thinned out and it goes up to grade 3 in the outer part of the patella. That is the facet of the patella. So these are called skyline views, and then the bone edema you can see over here in the upper end of the tibia, over here in the outer compartment, and also in the lower end of the femur over here. You can see the lower femoral condyle intraosseous edema. So these are the MRI scans of a patient who was affected by grade 3 osteoarthritis. Same features prevail on the left side, except that stop and focus. These are the MRI findings. Normal MRI will not do. You need the high quality 3 Tesla MRI to really make out where the damage is. The damage in the osteoarthritis not only occurs to the joint cartilage, but also it involves the bone, intraosseous or the subchondral bone, that is also involved, and it is necessary to treat those areas as well. Then we also see areas of meniscal tear, meniscal displacement, and meniscal root tears, radial tears, and all that. I didn't discuss about the menisci here because there are complex tears in the meniscus in the inner back part of the knee, but there is no significant. You can see the meniscal tear over there in that particular section. This is the back part of the knee, the meniscus. There's some white area here. Again, here you can see some damaged tear over there. But the meniscus is not totally at the back part. It is not torn, and the meniscus has not gone out. So there is no meniscal root tear. So in a 3 Tesla MRI, one is able to appreciate all these findings, and this is the importance of getting 3 Tesla MRIs before doing PRS procedures. If one is just going to do a meniscectomy or something like that, then other lower modality MRIs are sufficient, 1.5 Tesla. But for PRS procedure, 3 Tesla MRI are necessary. I always insist that the patient comes to Chennai if they are coming from outstation and get it done here because the reporting is good. The cartogram also can be done. I show you the cartogram also. So this is how you see the cartogram. You can see the areas of blue are normal, and wherever there is these red areas, they are all damaged cartilage. You can see areas of red over here. Blue is normal cartilage. Blue, most of it on this side is better, but areas of red, as over here, are areas hotspots of the cartilage. They indicate cartilage loss. So these are cartilage, and these are views under the knee. We were just seeing. I showed you this knee here. There is a red area of cartilage loss here. This is the right knee, and similarly on the left knee, you can see cartilage loss under the kneecap over here. They also provide a CD, and you can see the CT also if you have the correct software. So I hope you appreciate the importance of getting 3 Tesla MRI scans, and it may be a little bit expensive, but expense is nothing if you want to get a long-lasting solution for your knee osteoarthritis. The advantage is that if these procedures are done, the results of PRS solution are good for up to 4 or 5 years, and if need be, it can be repeated. But most importantly, I document these changes before and after. So if you come after 6 months or then follow up with me, then we can get repeated MRI scans to document the cartilage growth. Not many people are able to do that, but if they don't come, I presume that they are doing well. Another important thing is that if I see a patient with lot of bone edema, lot of bone swelling, then I don't take this. I don't accept those patients for PRS procedures. Recently, I've had to turn down a couple of patients. They had extensive bone edema, And those are not really osteoarthritis. They involve fractures of the bone here, that is the lower end of the femur. That's a separate disease. It is called osteonecrosis of the lower end of the femur. So if we see bone edema, then I don't accept those cases. And other cases where I don't accept are grade 4 complete bone-on-bone contact where there is no semblance of cartilage at all. So I don't accept those cases. Meniscal root tears with gross displacement also I don't accept. Thanks for watching. If you appreciate the information provided in this video, then refer to other videos where I have provided evidence of cartilage regeneration and X-ray changes. And you can also watch the procedures which have been done under ultrasound guidance. Refer it to your friends, share it. So if you have any doubts, you can put them in the comment section below. I'll see you in the next video. Cheers.